Alrighty, good afternoon, everyone. Incredible to see so many fantastic faces, friendly, fantastic faces. Can you give me a thumbs up if you're able to hear me? Fabulous. Thank you. I appreciate it. Welcome. Welcome to our after lunch call um, with our friends over at Ascend. Of the Aspen Institute around 2Gen work. We appreciate you all being here for our info session. This call is being recorded, and we are planning to put this on our website for anyone who is interested in learning a little bit more. As many of you guys already know, here at the United Way of Greater Chattanooga, we are about to enter into our brand new grant season. And a focus of this new grant season, as it was last season, is around that two-generational support for Alice families with children. So that is why we wanted to provide this info session as a refresher. This was offered last year, but Stephanie's got some incredible new content for us to learn from and engage with and collaborate around. So excited for that. I'm going to continue letting some folks in to the waiting room or into our call rather. Alrighty. Awesome. So my name is Megan Creasy. I am the Director of Strategic Partnerships here at the United Way of Greater Chattanooga. Once again, very thankful and happy to see you all on the call this afternoon as we continue to learn about new and innovative strategies for two-generational supports for our Alice families. So, without further ado, I'm going to kick it over to Stephanie Brueck-Cassoli. We were practicing ahead of time, so I'm not sure why I messed up right then. She is the Senior Program Manager for Ascend at the Aspen Institute, and she's going to walk us through, like I said, some information today around that two-generational approach. Thank you all for all the input you gave when you were registering for this webinar. That is what really shaped today's content. And excited to dive in and for you guys to listen and please engage with us. I'll be managing the chat as we go, and any questions that come up, we want to hear from you. So without further ado, I'm going to kick it over to Stephanie.
Hi everyone, thank you so much. I am going to share my slides and it's all full Mentimeter. So we are going to have an adventure together. I tested it, it should all work. But the goal is interactive because again, just as was stated, the feedback that you all gave on the content today really shaped what I've put together for you all. So let me just share my screen and hit present. And get ready to interact in this post-lunch, during lunch space that we're in. Okay. I'm going to do the Zoom thing. Everyone can see my slides.
Yes, it looks perfect. I love it.
So thank you so much, everyone, for being here. I'm Steph Brueck-Cassoli. I joined Ascend at the Aspen Institute 2 years ago, and my background is I'm a clinical social worker and spent 9 years at a nonprofit in Boston, Empath, who's known for mobility mentoring, if you're familiar. So my background really is economic mobility coaching, and I built their learning platform for doing economic mobility coaching across the country. So it's really fun to be in the learning space with you all today to talk about the two-generation approach, which is really occupies the same space as economic mobility coaching for the same reason. I'm going to give you a background on Ascend and Aspen just for some context setting, and I am going to go through some foundational concepts of 2Gen, again, because of that survey that came through that was so helpful. I've got interactive stuff happening on Mentimeter, and then please feel free to ask questions anytime. And I think, um, I'm going to enable questions from the audience. There you go. So you should be able to, even through Mentimeter, ask me questions. You have the code at the very top, 667132334. If you go to menti.com, and then you can follow along on these slides plus the questions. So Ascend is part of the Aspen Institute, and this can get a little confusing. The Aspen Institute has 600 employees, and it was founded in 1949 after World War II as a way to bring people together to ignite human potential and build understanding. And that still holds true. Despite our name, we are headquartered in Washington, D.C., which is also where I live. And then Ascend is one of many policy programs at the Institute, and we were founded in 2010 by Ann Mosley and a small group of catalytic funders after another important moment in history, which is the aftermath of the Great Recession, with a desire to transform how our society and our system listen to, learn from, and lead with families with low income at the center of the way that we build strategies, program systems, all in service of intergenerational whole family success. And our work continues to be driven by that. And we consider ourselves a catalyst and a convener for leaders working across systems and sectors with a focus on that intergenerational family prosperity. So, our theory of change, I wanted to bring this to light just for a moment because as we talk about the two-generation approach and or systems change work, we are really intentionally centering family voice and lived experience at the very center because we recognize nothing was changing 15 years ago and we're still, working on change and we weren't listening to families and meaningfully listen. And I will talk about that a bit more. But we really believe in this interconnected system of meaningful partnership that builds prosperity for families. And that's really the way that you'll see me talk about our two-gen work as it relates to Ascend. Okay, we're here for two-gen. Let's go. And I'm gonna give you a brief, I don't even want to call it a definition, but a brief way of thinking about the two-gen approach. And then please know I'm about to ask you your thoughts. So get warmed up. I won't ask you to come off mute, so it's just typing into your computer, but you can get Menti ready to go. So the two-gen approach, I want to first recognize that two-gen is the term that Ascend utilizes to describe the approach, meaning that you intentionally focus on children and the adults in their lives together. And it is important to recognize that it is not the only term. Whole family approach is another very common term. And we didn't coin either terms nor any of the ones that you see here. The notion of a two-gen approach can be traced back to indigenous roots, and we also recognize that the Foundation for Child Development in 1988. They were the first ones to start tracking really research and outcomes as it relates to a two-gen approach, and they use that term two-gen. So, in honoring the work that they've done, that's the term that we decided to use moving forward. Most importantly, you use the term that most resonates with your community. So, this two-gen graphic, if you've spent any time thinking about the two-gen approach, hopefully that's come up in your various searchings. The modern two-gen approach seeks to accelerate intergenerational economic mobility for families. And we think that's possible when we work with, and I'm going to say it again, children and families together intentionally and simultaneously. Intentionally and simultaneously. So there are no quote unquote two-gen outcomes. There are outcomes that you might be more likely to achieve if you utilize a two-gen approach or way of thinking or a way of structuring to get you there, but the outcomes remain the same. So, if you have outcomes from a historically child-focused program, so what you see on the left, you might have an outcome such as achieving child development milestones, and you believe that you'll have stronger traction towards that initially stated outcome for child development when you are intentionally including the child's caregivers and are simultaneously supporting their well-being or economic mobility to open up their bandwidth, to be able to support their children in what they're trying to do. Because we fundamentally believe that parents or caregivers want the best that's for their children, right? If we look on the other side of this, I guess you could call it a continuum, so to speak, is adult focused programs. So, what do adults need if they're pursuing education or training? They need high quality, reliable childcare. Bonus points if that childcare isn't intentionally connected to the education or training program, whether physically or matching the hours. And if you have that in place, you have higher likelihoods of completing the program and pursuing a career in support of economic mobility for your family. So that's the way we really like to think and frame the two-gen approach is really what is it that you are trying to support families in achieving, and what can you do to include the full family in the way that you are driving towards that outcome that can better get you to where you're hoping to get to. Okay, I'm ready to hear from you. So, why does two-gen matter to you? And just in the Menti, it should pop up. Here's to hoping. It's just a word cloud. So we're going to see what overlapping answers we have. Beautiful. Hmm, I see others answering in the chat. That's great too, if that's easier than going into Menti. Look at that. Healing is starting to really come through as a term that multiple people are using. And from the chat, we see family support, and it's imperative for generational change. Amazing. Healing and change, impact. Okay, we're seeing some trends. This is incredible. Generational change. This could be a real motivating word cloud, I think. Okay. So families can thrive. Exactly. We're all really aligned in why two-gen matters. And I know mattering isn't the only thing that we need to focus on as we look to our work. It's a bit of assumption that this matters to you. And the question is, how do we get there? So we're going to talk a bit more about that in support of all that you're trying to do with families, supporting their healing, their generational change. This is really wonderful. So there are 6 components of whole family well-being when we think about the two-gen approach, or the COGS, if you would like to refer to them as such. And I like to simplify it and just think of it as the what of two-gen. So when I opened up, I said, when we think about the two-gen approach, we're really talking about interconnected systems and partnerships that are there to support the full family in how they dream to move forward. So with the what of two-gen, we can think of these components in 2 parts. The supports and services that a family interacts with and needs to thrive, and systems at city, county, state, community, federal levels that drive funding and policies that have implications for families. So we have all 6 of these in that we recognize that a family touches on each of these component areas. So in the next slide, I'm going to ask you to actually do another Mentimeter and tell me which parts of the components you already deliver services in, or perhaps you have intentional partnerships already that enable you to deliver services in these component areas. So economic assets, that can include housing, economic mobility coaching, right? Health, including mental health, social capital, post-secondary and employment pathways, higher ed, workforce training, K through 12, early childhood education. Okay, I see early childhood education, health, including mental health, popping up in the chat. Great. K through 12. Interesting. I wish I could see how many people for each answer. 9 out of 20. Okay, let's see if we can get a few more answers because I'm so curious. Yeah. Okay, cool. This is so interesting. Um, Amazing. So, when we look at 2Gen work and when people join our network, and I'll talk about that at the end, we ask them to indicate what component areas they focus on in their work. And what we have found and what has been most well documented in terms of 2Gen, of the 2Gen approach, and I want to be really clear, I'm saying this not because they're the best, but because that just happens to be where funding streams have driven resources and therefore they've had the capacity to do evaluation on those work, is we've seen the greatest concentration in early childhood education and post-secondary and employment pathways, and usually the connection between the two. Um, and K through 12, the reason I'm like, oh, this is so interesting, we're seeing a majority on there, is that K through 12, actually, we have the least amount of information on K through 12 when it comes to a two-generation approach. And I'm just saying that as to be honest about what we've been able to explore in regard to partnerships and the kind of work that's been moving forward. So if you're in K through 12 and you've got some interesting 2Gen ideas, send them my way. I would love to learn more. Um, Amazing. Okay, on the next slide, we're gonna talk about where you want to strengthen or have more partnerships. And we could potentially bring this up later if we think that would be helpful. But so you saw the cogs, all six of them across each of these areas. The idea is that we can't all be doing all of those things. We've got experts in post-secondary, we've got experts in K through 12. Those are not the same, nor should they be. And how do you have meaningful partnerships? Or how do you intentionally hire staff with certain areas of expertise to holistically support your families from a 2Gen framework? Okay, great. Economic assets, really. Jill, are you wanting to partner with everyone? I love it. Um, okay, health including mental health. I might ask if people feel comfortable in the chat or to unmute themselves to just share a bit more about what is it that they're hoping to better achieve through strengthening or having partnerships in an area that they've shared. I'd love to hear from three people. So if you feel comfortable unmuting yourself or sharing in the chat why you picked what you picked. Economic assets. Yeah.
I can share. This is
Great.
Jill.
Hi, Joe.
Um, so we are a pediatric inner city clinic.
Mhm.
And so for us, health, including mental health, is our baseline, but also economic assets for our patient families is huge in order for our families to thrive, particularly in the area of food insecurity right now. Um, and then we also would just need partnerships with early childhood education and K through 12 because we want to be able to partner with the school system to know better how we could help those kids thrive.
Yeah, that's great. Jill, I have an example that I'm going to share later about linking some economic assets work with hospitals, children's hospitals specifically. So maybe hopefully that's
Oh,
interesting.
great. Okay,
Yeah.
great.
And then I have other, like the medical financial partnership out in LA is an interesting one if you aren't familiar as well. Great. Thank you
I
for
am not, but am
Ah,
interested.
okay. I have so many things I can share with
Okay,
you.
great.
Um, what else?
I can share. My name is Louis Marin Howard. I'm the executive director of the Pop-Up Project, and we're a dance movement wellness organization in Chattanooga. And so for us, and I'm a dancer by trade, turned arts administrator. And so of course, I've always known that there's been a connection with the mental health and well-being and dance, at large. But to be able to partner with partners that are professionals in that world and are the experts in the room, and even have some of our teaching artists on staff who have, backgrounds in early child psychology, and it's just really, really wonderful. And so the more that we can become more akin to that, especially as where the world is and where we're going, and as we see how important it is to restore and recover in our worlds, not just rest because you want to do it all over again tomorrow, kind of thing. This sort of what do you call it, hamster wheel world. So the more that we see that, the more we need to be more connected with that health and mental health world. That's where I would love to strengthen that. And that's where our work with the United Way is really helping us bridge that and build these healthier lifestyles. So thank you.
Amazing, Louis. Thank you so much for sharing. And I was thinking about too with you were saying your instructors and if they have a background in psychology, or maybe they don't, but I'm confident they're building very trusting relationships with the students and the children that you're working with. And so being able to support them and building their capacity to recognize the strength of that trusting relationship. Yeah. I was thinking of there's another dance focused two-gen partner that we have in our network. I think they're called Cool Moms Dance too. Anyway, I'll look, Louis. Amazing. Okay, Amanda. So we need to think about both physical and mental health. Our ability to be sustainable in the job fields, absolutely. And I think it goes on what Louis is saying, right? We're not in a hamster wheel. We're really trying to thrive, right? Bring dreaming and thriving back. There's no reason for us not to be able to think that way. I really appreciate what you've said in the chat, Amanda. It's really a holistic way of thinking about what do families need and deserve so that they can dream. Yeah. Beautiful. Feel free to keep them coming. As you see, I love thinking about what other work is happening and connecting you all to it to help strengthen what you're doing. So please, as we continue, feel free to share more questions and ideas. Because I want to make sure you have the information you need. I think of the kind of companion to the what, which is the components, is the how, which are the principles. And so, as a whole, we have these five guiding principles, and they hold us accountable to measure outcomes for children and the adults in their lives simultaneously while being grounded in family voice, racial, gender, and economic equity, and ensuring that we continue to encourage innovation in our solutions and align funding streams. So that we can have more sustainable practices. So that's kind of the way that we think about them in totality. And if you really examine any of your programs or any program serving families, the first four you are likely are doing or are striving to do. It's really the measuring and accounting for outcomes that differentiates what we're talking about from a um, good practice, I would say, to a two-generation approach. Now, I want to be really, really clear. I'm not saying that all of you, if you want to say you're doing two-gen, that you need to be measuring outcomes for both children and the adults in their lives, because there are also barriers in terms of funding and data structures and reporting that make that really complicated. And is there a way to, again, have partnerships that allow you to understand? And I think, Jill, you're going there too. And what is it that you're hearing from K through 12 that can inform what your medical practice is doing? And if we recognize that children don't just exist in the medical facility that we're treating them, but they exist in their broader community, what do we know about what's happening in their broader community that informs their physical and mental care? So, thinking about it in that way, I wanted to kind of offer the way that we think about that differentiation with measurement for outcomes. And here we go. This is what I was saying. So, I'm giving you some examples as it relates to the principles to bring this to life a bit more. So, one of the ones for accounting for outcomes for both children and the adults in their lives, Nationwide Children's Hospital, which is in Columbus, Ohio, and is one of the largest employers in Ohio, in Columbus, Ohio. And their initial purpose is children's health and outcomes that were measured for children, right? They're a children's hospital. They should care about children's health, and that doesn't change. What they also know is that for children to receive medical care, their families are coming into the children's hospital. And we also know that economic assets and economic well-being factor into the well-being of children. And so when children come to receive services at the medical facility with their caregiver, they have access to free tech services, VitaSite, with an economic mobility coach so that you could make sure that the kids get those or the family gets those child tax credits, which we know make a big difference. We're increasing the assets in that home and we're providing additional coaching to those families to figure out, what are the barriers for your family right now? What would help you unlock what you're hoping to achieve with your family? And that's all within the medical facility. So thinking about the child's well-being, health within the context of the broader family. And then they're able to track outcomes in terms of what are they noticing for trajectory of the child's health based on if their parents or their caregivers participated in this kind of free service. There's another similar one called Street Cred in Boston where they're doing that, and I'm sure other medical facilities are looking into those kinds of partnerships as well. So that's one. Any questions? The next one, family voice. So family voice is discussed as an important um, factor to include. And what we've been really trying to drive toward is what do we mean by intentional inclusion of family voice in the way that we structure programs and then actually change the way that we're delivering services or change the way that our systems function to center those families in the middle. So, one is Springboard to Opportunities. They're a nonprofit in Jackson, Mississippi. They're actually really the first ones to do guaranteed income pilot with their moms. And Aisha Niandoro, if you need some inspiration on how to center lived experience and make incredible changes for moms, she has been on the Kelly Clarkson show. She's wonderful. Anyway, just take a look if you need a little dose of inspiration. But one of the biggest things that I wanted to point out here is we all have really good intentions. I've said that. I fundamentally believe that to be the case. They were working with residents around affordable housing to help them reach their goals in school, work, and life with initial focus on mental health support. Amanda, that brings your comment in a little bit. So that's what they were trying to do. They really believed they had an approach in which they were best serving families. Well, then they listened to those families and they heard from those families that they, through a focus group, and they said that they care about mental health services and they want those, but they have access to mental health services in other parts of the community. And what parents want is more cash. And they actually, if they had the ability to get cash with no strings, right now we're talking about guaranteed income or universal basic needs, we're saying that we believe that we can make the best choices for our families if we had extra cash. So Aisha Niandoro, who I mentioned, put a lot of credibility on the line, and she really listened to what those families were saying and created the Magnolia Mothers Trust, which is that first guaranteed income program in the US. So it's not hard to listen to the voices of family, but it's really hard to check our assumptions and then shift when we hear something that's different from our assumptions, even though we had the best of intentions. So I offer that as an example of how to make sure that the way that we're delivering a service is actually achieving the thing that we hope it achieves. And then finally, thinking about aligning and linking systems and funding streams. Now, we all know that the environment in which we've operated in the nonprofit space or in medical space has changed over the last year or so. And we also know that funders are needing to think about the way that dollars are allocated accordingly. And so there's been a bit of how do we best meet the needs of families? And we also know that if we work together and we collaborate and figure out alternative ways to get at funding, we might have better luck. So there are actually two things I want to share on this. Um, One that's on this slide, we have the technical system of Georgia, and they really wanted for those enrolled in their technical system to be able to achieve the credential degree, right? That's what any institution is seeking to do. What they were realizing is that parenting students were having a harder time finishing their degrees because, well, they're parenting. And so what they did is they had a relationship with the Georgia Department of Early Care and Learning, DCAL, and that helped support parenting students by for the way that they could apply for child care assistance. And they had so many more applications for child care assistance approved through this partnership than previously, not because there's any differences in who those people are applying for that, but in the amount of applications that were sent and the ease at which that process was handled. The other thing that I'll say, and United Way fits within this way of thinking about it, is there's a community organization in Los Angeles, California, who is really, they have a partner, a network of 43 partners. They're not a funder, but they bring their community together. And what they've done informally is they get grant applications and then they figure out who within their community is best served to apply for those applications. And then they work together to fill out those grant applications. It's pretty beautiful. So I just offer that as an additional way of thinking about linking and being creative about funding streams and the way that we build systems that work for families. Those are my three examples based on the principles. It's 1:34, so I just want to pause for any questions that have come through. Um, Amanda, yes, Partners for Children, South LA. I don't know if they have that on their website, that that's what they do, but you can look at a way to be an anchor partner within a community. And if you wanted to talk more, I can connect you. Um, any other questions that are coming up for you before we continue on a little bit more? I'm gonna get some more Menti for you to add some open-ended thoughts. So don't worry, it's coming. So, what partnerships are you curious to deepen in your community? So maybe it's another organization, maybe it's, and it could be that you're curious about learning how similar organizations such as you in other parts of the country are working. You can feel free to put that in here. I'm gonna keep a record of this so that I can follow up too in support of you. So, what partnerships are you curious to deepen? UTC, what does UTC stand for?
That is University of Tennessee, Chattanooga.
Okay. And Chattanooga State Community College. Okay.
It's like our
And
two like big universities here.
beautiful. And the we is who?
Okay, great question. Housing, that's a good one.
Housing. Yeah.
I'm surprised of one that was not on here first.
Dang. Let's
If
see.
it's anything around transportation, we hear that a lot here in the community. The lack of public transportation, anything around transportation and transporting families to services. Thank you.
Yeah. Hmm. Including repairs for vehicles, yeah. And I've seen some really interesting funding models that where you have like emergency funds and you're able to apply those to specific things such as car repairs that are barriers to goals that families are setting out to do. Um, yeah, I'm with you on I'm actually seeing the executive director of that Partners for Children South LA in a couple weeks, and I'm looking forward to hearing how we can replicate it a bit more because it really is fantastic to think about communities coming together in that way. More resources for housing and financial supports for families. So what I'm seeing is, so the first question was the first comment was partner more with the University of Tennessee, Chattanooga, and Chattanooga State Community College. So we're looking at a partnership there. What I'm seeing is a couple things about resources for housing or transportation. And so there we're talking about how do we get access to knowing who in the community could do that work. What I might offer is a way to think about what would a partnership, how does a partnership differ from access to resources? You could still be getting those resources into the hands of families. And I wonder through a partnership if you're then better able to hold accountable the way that your families can access those resources, and you can better determine how much that kind of partnership, whether it is having the impact on the families that you were hoping it does have, right? Because that is, I know we use a lot of outcomes and measurement in service of, let's say, I don't know, grant requirements. And another powerful tool of measurement and data tracking is to check your own assumptions about practices and programs that you've put in place and how effective they've been in what you're trying to achieve with your families. Um, so, partnership, let's see what else we have. Food coalitions, how we can work together if we get another SNAP crisis. So another something new that's on the horizon that should be able to start being able to be pulled out a little more widely is technology is we're figuring out how to make technology our friend. And there are apps and platforms that are being developed to support case managers, caseworkers, social workers in the way they can talk about benefit maximization with the people that they are working with or serving. And so we're talking about no PI, no personal information going into those platforms. It's simply like the zip code, family makeup, et cetera, and it can tell you all the benefits that you qualify for. And a recent update to that platform I'm talking about has also made it so that news gets pushed into that app and helps caseworkers in understanding, like basically weeding through the noise, of which there is much, and how to know what other community resources exist when SNAP is not an option. How has the city you're in potentially stepped up? Because some cities had reserves of cash that they filled the gap for SNAP benefits on, but every city, county, state handled things differently. So I do want to offer that as if you're interested in a possible tech partnership, or if United Way of Greater Chattanooga, you wanted to explore that, I'm happy to connect you because it's a really interesting new model on the horizon. Um, how we can partner with families that are trying to get out of predatory loans. Oh my gosh, yes. Yes. Financial literacy, maybe partnerships with financial literacy institutions. Ah, we have some great things going into the chat. Thank you so much. Partnering more with WIC Health Department to outreach for underserved populations. Yeah, awesome. So that's really tangible. So if you're trying to figure out how to get to populations that you might not have in the service delivery that you're employing, but you know that they could benefit from your services, or you hope that they could, what are some partnerships that you could access to better get at whole families? And WIC and Health Department is genius when you talk about a whole family approach. Awesome. Great. Really good idea generation. So keep generating, thinking about how to unlock possibilities for families. Let's see, this is blog with young adults. Yeah, yeah. So, and there have been other economic mobility programs that offer cash incentives throughout the program, and there's been some evaluations about what does, a flat 500 a month additional guaranteed amount of money due for a family if you do that plus economic mobility coaching while they're getting something like a CNA, because it is a lot of time, right? So how do you kind of fill that gap in knowing that they are gonna track towards economic mobility, and be participating in the workforce in that way? Yeah, really interesting. Great ideas. Oops, sorry, somehow I made your answer big. I don't know. Okay, off to the next. So the only other thing I wanted to offer, before we just start to do a bit of a close, is Ascend in the last 2 years has been focused on building collaborative frameworks and toolkits because of some of the work that we've been doing deeper in communities and states. So we launched an assessment analysis of opportunities in LA County and New Mexico, and that was with support from the Hilton Foundation, who is really focused on LA and New Mexico. And so we were able to build out a framework and a tool that can support them in how they build the kinds of relationships to unlock family prosperity in the way that we've been talking about today. So I just wanted to make sure that you had access to the resources, and I realized that my link is not in here, but I can send it to you in a moment. But the basic premise is, similar to the way we've been talking about the rest of the two-gen approaches. It's really important to do your due diligence on conducting a landscape and demographic analysis. And United Way, I know you work really hard on that, and you've got your ALICE indicators, and center community partners and parents in doing so. We have found that while Zooms such as these are obviously life-changing and wonderful, just kidding, in-person convenings really do make quite a difference in meaningful relationship building that then leads to the kinds of innovative partnerships you were already just brainstorming in those 2 minutes. I mean, based on what you put in the Menti in 2 minutes, I can't wait to see what else you come up with when you have more time to do so. And that you then collaboratively are developing a plan of action. So that Partners for Children South LA that I mentioned earlier, they participated in this and were a huge anchor partner in the way that you build out a collaborative framework. And the way that you have anchor community partners within the community that you're in. So Ascend is not that, because we don't live in Tennessee. We don't live in LA, and it's really important to find those key anchor partners, build a plan of action, and then you reference back to that as you continue to build out your two-gen work. And what I really want to repeat, because it's so important, is that a two-gen approach cannot just live on the shoulders of one organization. And so it's really about identifying, maybe it's even taking those cogs and you map each other on those cogs and you figure out who within those cogs do you have proximity to, and how can you build partnerships that really allow for that continuous cog to actually work as it's supposed to, with the gears turning and all working together, right? And that's the premise of the collaborative framework, and it's a resource that I can, and maybe when we send out a follow-up email, I can just include the link in that. Okay, let's do that. Um, so really thinking about what we can do to unlock that way that those gears work together. But what we really learned is the importance of strengthening parent voice, having parent voice councils, like actual bodies that govern the way that they inform practices and system involvement. Um, we need to manage the data and research barriers, because having your own data system is a huge financial undertaking for you. And what are the partnerships you can have so that you can have more control over your data systems? Integrating early childhood and post-secondary services, we know this to be critical. And the same thing applies to workforce development, career pathways, employer partnerships. What's not on here, and I want to recognize, given Amanda's comments in it, is all of this undergirds, like well-being has to be wrapped around this fully holistically. So I do want to acknowledge that it's not in here. Not because it wasn't a finding, but because it wasn't in here. So last thing, I want to hear from you about what actions you're ready to take based on what we talked about regarding 2Gen. I even gave you an out that you've learned a lot today and you're still thinking about it, but I would encourage you to pick just a quick action item you're ready to take based on what we talked about today. And then I'm going to share next steps in terms of our network and what's coming up. And if you have an idea not listed and you feel comfortable sharing, please feel free. You know, if you've gotten to know me in the last 45 minutes, I love to hear your ideas. Looks like we're debriefing with teams and setting up meetings, looking to do a parent advisory council. We've got a ton of resources too on parent advisory councils, and I can include that in the debrief too. Um, great. We're reflecting. That's okay. Yeah, I hear that, Jill. And it's really important that it doesn't feel like you're just adding on a two-gen effort just to say you've done it, but how does it really move you forward in what you're hoping to achieve? I think that's really wise. Um, Great. I can't wait to hear how things continue to develop for you all. Let's see. Yes, please include info on parent advisory. Will do, Louie. We've got a couple of them. And one that's specific to post-secondary, and then others that are more broadly about structuring those. Amazing. I'm going to need some accountability metrics to remember which resources I said I was going to share. And I don't want to watch myself on this recording. So amazing. Okay, great. So just to bring it full circle, I want to share that we do have a network, and I'll include that in the follow-up too, and it's completely free to join. We have over 640 network partners in all 50 states, which I think is really wonderful. All 50 contiguous states and Puerto Rico, and we've got a few international partners as well. But the point is that we all want what's best for families. And we have this fellowship of 200 fellows, this network. Join us. It's free. You get our newsletter. You can see what else is coming up, pop-up events, anything. If we're coming to Tennessee, you'll know. So please feel free to join. And that's it. That's what I have.
Thank you, Stephanie. Does anyone have any additional questions for Stephanie now that we have her? I thought that the mentees were really strong and fabulous. And once again, um, we were really able to customize the content for today because of the input given ahead of time. And so I appreciate you all for your engagement and helping us make sure that this is a educational and really impactful webinar. Awesome. If anyone finds themselves thinking later tonight about an idea or a connection or a question, please feel free to reach out to me directly and I can get you in touch with Stephanie or we can brainstorm it together. I am so deeply impressed with the mentee around which partnerships do you want to um, strengthen. There's clearly been a lot of thought already put into the work. And I, once again, am deeply impressed by the intentionality there. So, very exciting stuff. Um, Thank you, Stephanie, for putting your information in the chat. Appreciate you. United Way is a proud network partner of Ascend and cannot thank you enough for all of the resources. And we will be doing a follow-up email trying to include as much as possible, but also shout out to you all. I think you have a really powerful website. Every single newsletter I receive has so much information and links and all sorts of cool things. So I appreciate that as well. Last but not least, for those of you on the call today that might be interested in learning more about the United Way's upcoming grant cycle, the United Way, we are putting on two info sessions coming up in December. We're offering 2 different days and 2 different times, but the information is going to be the same for both sessions. That is on our website. I can drop a link if you're interested in registering for more information in regards to that upcoming cycle. We are continuing, thank you, Jess. We are continuing to update the website with different guidelines for this new cycle and other things like that. So, also the timeline listed on there if you're curious. We want to be as transparent as possible as we head into this new cycle. And if nobody else has any questions, I'll hang out for a second, but I hope that you all have a phenomenal rest of your Wednesday. If you are ever needing more information from us here at United Way, another great resource outside of our website is our nonprofit support newsletter. We typically try to put as much information and things that are coming up in there. And there's a link on our website to also sign up for that. So it'd be great if you were able to do that. But yeah, outside of those things, I hope everyone has a phenomenal rest of their day. We'll be sure to save this recording as well as the chat. And like I said, if anything else comes up, please reach out. We'd be happy to connect. Thanks, everyone.
Thank you.
Thanks.